disc, go ahead and wash your hands, and then I want you to gather all of your supplies. A bowl of soapy water and an additional bowl of clean water. We're going to have our gauze pad, our scissors, our coverall, our Tegaderm, and our Telfa pad. Our next step is going to be to go ahead and take down the dressing. Now, as you're doing this, be very gentle with the skin. Remove the tape very gingerly. And most importantly, you want to be sure that as you're removing your dressing, that you're not tugging on the tube in any way. So secure the tube in place as you pull away your dressing. And go ahead, take your old bandage and throw it away. Take a break, and again, go ahead and wash your hands. Washing of your hands is very important so that we can keep away infection. At this point, we want to take a look at the skin. We want to look for rashes, any kind of skin breakdown at all. And go ahead and remove your Tegaderm. Now this portion here that has the Tegaderm on top only needs to be changed once a week. The dressing that we just took off, that will need to be changed twice a week. You want to secure your Molnar disc as you remove the Tegaderm. My doll is very sticky. This will come off of your loved one much easier, or yourself, if your tube is in the front and you're able to do your own dressing change. Remember, it's very important that you not pour water on this tube, that you don't go swimming, and you don't soak in a hot tub. Go ahead and remove your Tegaderm and the little collar that's up underneath here. And again, because we're using and touching old bandages, you want to take a break and wash your hands again. We have a washcloth and a towel. We're going to take our washcloth, dip it in our soapy water, and very gently clean around the skin. What works nicely here is that you can lift up half of your Molnar disc and do that side, come on the other side and wash under here. Now you want to rinse in your clean water and come back. Don't leave any soapy residue on the skin. Take your towel and gently pat dry. You do want to get water out from underneath that disc. If you want to attempt to take a shower, you can use cling wrap or press and seal saran wrap. Wrap it all the way around your body. Do this for the very first time when you know that you're going to be doing a dressing change. That way, when you get out of the shower, you take your dressing down, and if your dressing is completely dry, you know it's worked, and you can go ahead and use that technique in the future. At this point, everything is nice and dry. We're going to take our Telfa, using our scissors. We want to create a circle that is about the approximate size of this blue disc. So go ahead and cut your circle. You don't want it to hang out too far out over the edge, but you also don't want it to be too small. In order to slide it up under there, we're going to cut ourselves a straight line right up to the center of our circle. Also, you want to take note on whether or not this disc has slidden down the tube. If it has gone down the tube ever so slightly, you can very gently push it back into place so that it's against the skin. But if you find that it's pretty far away from the skin, go ahead and attach it as best you can and call interventional radiology to be sure that they'll be available for you to change that. But at this point, we just want to very gently slide our Telfa ring up underneath our Molnar disc. This will be much easier for you. My doll has been through many demonstrations, and so it's a little sticky. Okay, so that is in place. Now we're going to use our Tegaderm. And once you get yourself a template for the exact size, you can go ahead and cut yourself multiple discs for the future. But at this point, we're going to use our Tegaderm. You want to take your towel, because we're going to have to be removing the drainage bag from the tube. And any drainage you want to occur on your towel. But take your Tegaderm, fold it in half, and cut yourself a nice triangle right in the center. This will create the hole that will allow you to pass your catheter through here. So at this point, we need to detach our drainage bag. Now we're going to pop this Tegaderm right over and through. And just slide it over here. Now this triangle that you've created, the hole, you just want to make sure that it's big enough that this little neck will pop through, but you don't want it any bigger than your Molnar disc. At this point, you can actually attach your drainage bag again. Now we can peel back one half and then just tear the back away. Take that sticky side and just go ahead and adhere it to the skin. Do the same for the other side. Just peel away that backing. Now you can remove that outer ring. It's got a nice little tab for you to grab a hold of. Okay, so at this point, we have our innermost dressing in place. This dressing only needs to be changed once a week. The part that we're going to be doing next needs to be changed twice a week. So this is our outer dressing. Take a 4x4 and fold it in half. Place it next to the Molnar disc. Repeat for the other side. And take one completely flat and open and just lay it on top. And the purpose of this is just to make sure that your tape is not on top of your tube, and you just really want to make sure that you're not kinking this tube at all. Now we're going to use our coverall. Again, once you just figure out what size works for you, you can cut multiple pieces the same size to use for the future. But just kind of lay it up there before you cut it, You want about an inch on each side. It'll help you determine what size you need. Note which line and go ahead and cut along your line. There's a short half and a longer half. I like to peel away my shorter half first. Grab your edges. Come up to your dressing, get about your inch, and lay this half down. I like to peel this half back, grab my edges, and then just pull it out nice and smooth, pressing down as you go. And again, my doll, she's a little tiny. But that's all there is to it. A nice dressing change.